watching Daybreak, and thank you for staying with us. The hashtag on X is Daybreak. The SMS code is 22422 at Citizen TV Kenya and at Ayub Abdikadir. We will sample your feedback in the course of this broadcast. Honorable Mary Maingi, coming to you. Given what we have talked about, because the numbers from Nakada aren't that pleasing, because looking at even alcohol consumption generally, it's highest in Western Kenya, leads by 23.8%, followed by Coast Region at 13.9% and Central Kenya at 12.8%. In looking for answers from policy perspective, where you and Honorable Anthony Kibagen, the seat where agencies like Dr. Yvonne and Stanley Kamau head, look for answers from the policy intervention perspective, this is having a daunting impact, is it, even at the family level and at the society level, of having people who seem to be unproductive and unemployment of Kenyans, which is also a contributory factor of this substance abuse that we are witnessing.
I have a different approach from my colleague, Honorable Kibagendi.
Yeah.
In my view, I think we should ban the whole trade of illicit brew. Kenyans are dignified people, and I don't see why we are subjecting Kenyans to second class or second and third generation brews.
Yeah.
I think we need to declare this an epidemic. I think we need to deal with illicit brew ruthlessly, like the way we deal with banditry, the way we deal with terrorism, and through an executive order or through legislative measures, we can come up with laws that treat anybody trading in illicit brew, the manufacture, the sale, the consumption of illicit brew, the way we treat cocaine, the way we treat terrorism. I would be a bit radical if I was the person to make that decision. And it is unfortunate that my colleague cannot see anything good that this government has done. He can only see that the government has dealt, the Deputy President and Her Excellency, Pastor Dorcas, has dealt with this and nothing else. It's quite unfortunate that you have eyes and you cannot see.
And if he were to see, then to open his eyes up, what's then what he pointed out in terms of the initiatives led by the Deputy President, who has been very vocal, and he also pointed out his frustration at government officials.
I think Abdul Kadir, I had not even finished what I was going to.
Please proceed.
I was going to propose that we have a drugs elimination agency, a small outfit that has powers to arrest and powers to prosecute. Because if I look at people like Nakada, okay, they may be willing, and it's not even about funding. They don't have the powers. It's a commission, it's an organization, but they cannot come, arrest, and go prosecute. This time around, we see our police officers. They are going to arrest. They take the offenders to court. And like, if we look at the case of Kirinyaga, the case of Moya constituency, this particular person had been arrested 16 times in less than 1 year, taken to court, and the most I saw, according to a fine, was 2,000 shillings. So the fines, most of the times he was set free because of lack of evidence or something flimsy like that. Other times he was fined 2,000 shillings, other times 5,000 shillings. I think this is a joke. The judiciary and the executive, in my view, must work together. They must be in sync for this to be eradicated. So we cannot have the police officers arresting, the chiefs arresting, taking to court, and the courts don't do their bit. Some people are sleeping on the jobs, others are not, and we cannot now, as government, pass the buck. That is why I'm suggesting we have an outfit that deals purely with illicit brew, because that is what it is. When you have 17 people dying all in one day, that is what we find in Shakahola. That is what we find when we have a terrorism attack. I don't know why we have kid gloves when we're dealing with this illicit brew. I have seen people die, but I've never seen people die because they have not taken brew. I mean, we can do without this. Remember, there were times when Kenyans used to smoke anywhere. These days they don't. It was just an executive order that was passed, and people stopped smoking everywhere.
All right.
So this can be done.
Yeah. Stanley, can that be achieved? I mean, if, say, we have to practicalize what Honorable Mary Maingi, for example, here has proposed, in the end, then how do you police the human brain? Someone can go and hide and abuse a substance as he or she so wishes.
I can tell you for sure that the government has all the policies in place. What we don't have is proper implementation. Like now they're talking about closing the bars and opening them. Do they have the inventory of what is sold in those bars? I would suggest that all the county governments, if I own a bar, I should have an inventory of the drinks that I sell from ABL, from Qual, or from whichever other manufacturer. And then if I'm going to add any other manufacturer or any other drink from outside the country, whether it's imported or whether it's been brewed here in Kenya, I should be able to add in that inventory so that from my office in the county government, I can tell an A and B and C bars, they are selling products from 1, 2, 3, 4 people. And then if we have that control, we have the inventory of what is being sold in those bars, then we can be able to control it. But just licensing a bar from the office or doing an inspection by being told this is what we have, that will not help anybody. And I've told you here, tomorrow if we hear people have died because of consuming bangi, which bar are we going to close? Which den are we going to close? So closing anything does not add any value anywhere because these things are not licensed. They are not in the bars. They are not in any registered outfit. What is registered? No one would come and tell you, I'm going to be selling illicit brew, so register me to be able to sell it. So they will never actually declare that they're going to sell illicit brew. So it's for the government, the communities, and any other, the stakeholders to come out and fight these fights together. Otherwise, as a person, as a business person, no one is going to declare that they're going to sell those fights. No one will ever do that.
So the directive to close and shut all bars, for example, in Kirinyaga County, I mean, they just happen, the bar owners happen just to be victims of circumstances.
I'm just saying it's a way of creating awareness about the illicit brew, but nothing else. It will not help anybody. And I can tell you even Kirinyaga, like yesterday, there are people who drank because they are not drinking from what has been licensed. We only closed the licensed bars, isn't it? We didn't close those illegal dens. So we need to go to the dens. Let's not affect business people who are doing legit business.
And that's exactly my point. I mean, when you look at bars, they don't sell illicit liquor, is it? Illicit brew. No. They don't sell illicit brew.
Yeah, no, they don't.
They do sell licensed, isn't it?
Yeah.
I mean, if then you have no mechanism to monitor these dens that sell the illicit liquor or the illicit brew, but you ended up closing or shutting down bars, is that not an unfair treatment to businesses that are operating?
In fact, what will happen is the people who normally drink from the licensed bars will look for those dens. We are creating more harm than good to those people who want to go and drink in a licensed bar, because some of these people have got very bad withdrawal symptoms because of taking alcohol. And now they are going to look for those dens. That's what they're going to drink from. They are going to drink for those homes that are used as agents by these guys who manufacture this illicit brew. So the best we can do is, first of all, to use the bar people, the bar registered bar owners, to be the one of the stakeholders in the fight against illicit brew. But not fight them.
Yes, I'll come to Honorable Maingi. Allow me to get Anthony Kibagendi's thoughts here. Honorable Kibagendi, I'm looking at the numbers because in the course of this discussion, we have not talked about cannabis, we have not talked about cat or mira, we have not talked about tobacco, we have not talked about polydrug users and prescribed abuse of drugs. But looking at, for example, portable spirit, according to an Akada report in 2023, it points out to Central Kenya as with the highest prevalence at 4.1%, followed by Coast at 3.2%, and the Rift Valley at 3.1%. This discussion ought to be more than is it illicit brew and ought to be extended to wholesale substance abuse by other parts of the demography who seem to be the silent majority, yet we are only focusing on what happened in Kirinyaga and what's happening in Western and Central Kenya, is it?
Absolutely. You know, families are suffering intolerable grief because of substance abuse in general, not necessarily the banned ones. And my colleague here, Honorable Mary Maingi, has misrepresented me. We genuinely appreciate the Herculean effort of the Deputy President and his spouse in the work they have done in creating awareness. But I do not agree, just like my friend Kamau here has said, closing legitimate businesses is inappropriate. What we need is enforcement on ensuring doing inventories on what is being sold in these pubs. Beyond that, we also need to increase awareness and advocacy on telling people even the legal alcohol has effects. It is tearing down families. People who drink actually alcohol that is manufactured by EABL, that is what we are talking about. Those are, again, if they are consumed excessively, it will tear down families, it messes up your work ethic, it messes up a lot of other things, even your discipline in various other aspects. While Mount Kenya has been greatly affected by deaths in subsequent years, the effects across the country are enormous. And look here, effects are not just deaths. We have mental health issues that come out of this, that emanate out of substance abuse. We have infertility issues. Yeah? We have broken families. We have people neglecting their jobs, yeah? Which has a massive compound effect on the economy of this country. So when we talk about creating awareness, we cannot leave this to government alone. It is something that all of us need to get involved in. To the extent I would ask you that in every bulletin, you remind young people of this country when you're let's say on a break, remind young people of this country, because they are the most affected, that getting into drugs is easier than getting out of drugs. Because once you get addicted, it becomes a problem to get out of it. We all must get involved. And that is why I've been, when we sit with NACADA and the other agencies that are involved, we are seeking funding, not just even from government, even from partners beyond our borders, so that we support even CBOs and NGOs that are involved in this. We have organizations like ISAP, we have Drugless Generations, we have one big one in Nyanza that is doing a very good job. We have so many other NGOs and CBOs within Nairobi. By the way, in terms of now hard drugs, Nairobi and Mombasa are the most affected. In Mombasa, it has now become a bigger problem health-wise, because for those who use injectables, now they do not even afford needles and syringes. So they actually share. I inject myself and then inject her. Yeah? So their HIV and AIDS is, again, being, we are spreading HIV and AIDS. And sometimes you, as Abdikadir, has been probably called by a friend to a place where they have that drug. You go there, inject yourself a lot of that drug, and then drag yourself to your den, because I cannot afford that drug. So what do? I take blood from I inject you and extract blood from your body, your veins, and inject myself so that I also get high. There are no medical, it is a whole mess. And hence, we all genuinely need to get involved. But for the time being, those that are given the responsibility, that is from the chief, their deputies, the ACCs, the DCCs, who are down there, they need to aggressively go out and stop this. Because sitting in offices genuinely will not be able to do much.
Thank you. Yes, Honorable Mange, I'll come to you, Doctor. Yes, you had a point, please.
I was going to say that this problem is so serious, it's so deep-rooted, that we need to re-engineer the whole idea of dealing with illicit brew. We need to rethink, we need to reorganize, we need to re-strategize, and we need to restore. And that is why you saw the directive of closing the bars. And again, I differ with my colleague. The reason why the bars were closed is because we need to restart this whole process. We have so many bars at the wrong place. We have bars that are just less than 300 meters to a school, a secondary school. And that is even affecting kids that are going to secondary school. They are starting to partake of the same drugs and stuff like that. We have others which are so close to churches. We have others close to hospitals. What is this doing? This is causing more harm. So that is why we are now starting to revet these people. If you are so close to a public institution, then you don't get your license. Then if you are a civil servant, like the Deputy President directed, then you cannot be licensed for obvious conflict of interest. So I deal with that, and I say we need to re-engineer, just like business re-engineering.
Yeah. Dr. Yvonne, because I look at also part of that statistics that you have issued as an agency. I'm looking at the prevalence of drug abuse, for example, among primary and secondary school students, as well as adults aged between 15 and 65. Tobacco is among the most abused by pupils, attributed to peer pressure and exposure at home. Statistics also on the prevalence of alcohol, miraa, bang, prescription drugs, heroin, cocaine, and inhalants abuse among students. Average age category for initiation into various ages, various drugs. 1 in every 6 Kenyan aged between 15 and 65 are currently using at least one drug or substance. This is generational crisis, first. Second, then what are the rehabilitation mechanisms? If you were to observe these people and counsel them, get them out of addiction, takes a lot, is it? Because that now shifts altogether to the war of the mindset and convincing them to unsubscribe from addiction to certain drugs.
Yes, thank you, Abdikadir. And I agree with you that the process of rehabilitation then could become very intensive. But the statistics you've just mentioned among the schools, both in primary and in secondary, the structures that have been placed, because when it comes to management of children, is actually different from when it comes to management of adults. And we have evidence-based interventions that have been shown to work in this kind of settings. In our schools, for example, NACADA, in collaboration with partners, Ministry of Education and TSC, came up with the basic guidelines for alcohol and drug abuse interventions in basic learning institutions. So when you look at these guidelines, which were disseminated to all the teachers, clearly is put, how do you intervene when I suspect Abdikadir is smoking? Yeah. How do I intervene with my suspicion? If I find Bwana Kamau here is actually in possession, how do I intervene? So these interventions are put in place so that the teachers then can be able to attend to that student at that level. The guidelines are also clear. The aspect of suspension and expulsion, when you suspect that a child is using, or even after you've confirmed that a child is using, is not support. Children are supposed to be in school. So the interventions for the schools, those ones are well cut out, and it is supportive. And what NACADA has done is come out to train the teachers. We have life skills programs in different schools. When it comes to the general public, because we know rehabilitation programs are not that many. We have about 300 rehabilitation facilities. We have more, but the ones that you can say have been inspected and accredited. Because again, we have people who open up a room and call it a rehabilitation facility. Then the next thing you hear, NACADA is being called that people are being beaten in a particular rehab. And on that, I'd just like to also highlight, Honorable Mary mentioned about the powers NACADA has. Because of lobbying and support from honorable members like Kibagendi, NACADA has authorized officers. Towards the last year, they were actually gazetted so that they have some sort of power where we can do the raids. You've been seeing NACADA now doing raids on Shisha and all this in partnership, of course, with Ngao and ANU, so that when we, for example, get these Shisha bongs, we can hold them. They don't disappear. You know, we don't say we worked with them and then they went. No, NACADA can actually now be accountable because we were given some power to do that. Now, when it comes to rehabilitation, also NACADA has some powers we do the inspection and accreditation of these rehabs. You don't bring somebody there and force them to get born again in the name of rehabilitation. Or you read the Quran for them every now for the name of rehabilitation. The step we have done, we have lobbied NHIF, and NHIF now has accredited several rehabs. If you're a public servant, for example, there are rehabs that you work in with the NHIF and you're treated for free for 3 months. If you're not a civil servant, there are rehabs that you work in with the NHIF and you're still treated because the rebates will be reduced. These are the kind of support we are giving. We know it is not cheap, but it is affordable to some extent. As NACADA, we were given a directive to set up a rehabilitation facility, which was set up in Mombasa.
But how many can you accommodate?
That's now the process. In Miritini, we are doing about outpatient 300 on a daily basis because not everybody uses alcohol and drugs has to be in inpatient facility. We also have the outpatient facilities, and these are the ones you're pushing for. Right now, we are about to roll out a guideline for community-based rehabilitation. You do not need to go to a facility. You can be supported at the community level. So we are trying as much as possible to make treatment and rehabilitation accessible and affordable to the general mwananchi.
Because I point that out because in November last year, you said that NACADA, 1 million people abuse drugs and alcohol in the Rift Valley region, more than 1 million that is, and with over 400,000 people in need of rehabilitation services. You only talked about coastal Kenya. I mean, if this is, for example, only the Rift Valley, we have not yet mentioned how many people need rehabilitation in Central, in the coast, as you have mentioned, in Nyanza and in Western. They could be in millions. And how do you then provide monetary mechanisms for all these people who need counseling, for example, and rehabilitation, and who are not getting that at the moment?
Yes, and thank you for that, because you've actually brought a vital point that you've been pushing with the governors. When you look at the the ADCA 2010, it is clear that county governments are supposed to be providing rehabilitation facilities. You've given the case of Rift Valley. At that time, we were in Bomet, and the best part is the county government had set up a rehabilitation facility to take care of its people. We have the same that have been set up in Kombani, in Kwale. The county government has set up a rehab, which is free for anyone that is from Kwale. We have Ihururu in Nyeri. The county government has actually set up that rehabilitation facility. And we have 11 of these county governments that have come out to do the same. And we are pushing that if the county governments can actually fulfill this particular aspect of setting up for each of their counties to have a public rehabilitation facility, then this issue will be addressed to a large extent.
The point of accountability is what you're mentioning. And the governor, Anne Waigoro, was clear that even some of her chief executive officers are also doing the business. I mean, this ought to have been very clear from the onset as to how the county governments failed to nab that, and also how all this escaped their radar and the proper mechanisms that ought to have been put in place. Yes, Honorable Kibagende, please.
Thank you. I want to agree with Honorable Maingi on the issue of licensing. It needs to move from the counties to NACADA, because there is a fund, the licensing fund. That amount is one of the amounts that is not submitted to the Treasury or the Consolidated Fund. That amount remains with the county. It is supposed to help with creating awareness. That amount is supposed to support CSOs that are in that space. It is supposed to be, there is a fraction that is supposed to be sent to NACADA to enhance its activities. So, like Honorable Maingi said, politicians will want to not to disappoint their voters. So sometimes licensing is skewed. You give your friend a license, you know he has a pub in a residential area or next to a school, but you still go ahead because of political gain. So we need to move this from the counties and to NACADA, because even governors that actually collect this fund, they use it as their pocket money. They don't use it for the work it's intended for. Number two, there's something called harm reduction, where there's a concerted effort. Honorable Passaris is very big on this.
Honorable Kibagende, as you proceed, when you say the money that is collected by the
counties,
devolved units, ends up in private pockets, I mean, we have a system of government where at the devolved units there are systems, checks and balances as to how the finances are accounted for. Do you then mean that there is en masse embezzling of the billions of shillings that are collected as a result?
My brother, look here. Yesterday in the papers, there was an expose by the Control of Budget, where she said from their findings, the president or the presidency spent 700 million to put up a dais at State House. Do you know 700 million?
No, that money was never approved.
Wait, look here.
No, she never approved that.
Okay, now.
Okay, to just be clear, it was a request, and if you look at the Control of
That
Budget,
is not the only amount, of many others.
To be just clear, because we want accountability so that no party feels there's an unfair treatment. And she was very clear that the national government requested to spend 47 billion under an emergency provision that allows withdrawals without a parliamentary approval. Among the blocked expenditures were 1.1 billion by State House for the purchase of vehicles and building of a modern presidential dais. There was a request put forth, but was rejected.
But
to be clear.
Look here, the presidential dais was constructed. It has been rehabilitated. It is probably, while they did not approve, money was spent. What we are saying, it starts from the top. That is where we have a problem. The county governor is the CEO of the county. He knows that money is being collected for this purpose, to create awareness, money that is supposed to go to CSOs and CBOs that are in that space, money that is supposed to go to NACADA. How many counties actually do that? 1 or 2. Yeah? They are supposed to, in Kisii, we have a rehabilitation center that was constructed in the first term of the first governors.
Governor Ongwae.
Yes. It has never been opened. The doors have never been opened like this. It is accumulating dust. What we are saying, people must start taking responsibility. And I had moved on to the issue of harm reduction. Harm reduction, like I said, Madam Passaris is big on it, and the National AIDS Control Council, they call it the National Syndemic, where we have drug users who are using injectables. What they have done, they provide them with needles and syringes so that the harm is reduced. And there is in Miritini, where we have one of the biggest rehabilitation centers, they are also getting some methadone that helps those who are using extremely hard drugs are being taken through rehabilitation. They keep using it in smaller dosages so that over time they are able to get out of that. And even in our communities, we can start by reducing harm, asking these people to move from illicit to genuine alcohol, but take in amounts that do not injure them. In my constituency, I wanted to also mention, like Madam Mary mentioned, what we have done. We have partnered with the administrators. That is from the deputy chiefs, the ACC and the DCC, and we are going very hard on the people that are selling drugs and those that are selling illicit brew. And at some point, there are those who are willing to get out of that trade. So what we do, we bring them, we ask them, what other trade do you want to get into? Someone tells you they want to get into selling of tomatoes or groceries. We look for 5, 10,000, 20,000. We help them get into legitimate business. Some say, me, I want to get into border business. Yeah. We help them with the deposit that they need to get a border so that they can get to actual legitimate business. And like I said, the war against drug and substance abuse has to involve collaboration and synergy from all players. And starting from the Ministry of Education, the Ministry of Health, parliamentarians. Last year, through the caucus, we encouraged members of parliament. We used to have a fund that now they have removed from CDF that was focused on sports and talent development. Yeah. That fund, in December, is when most members of parliament pushed for the sports tournaments. Yeah. In my constituency, We did football, we did athletics, we did even eating competition. You know, it is fun. In that space is where we partnered with NACADA. We encourage young people not to get involved in drug and substance abuse, and those who are already in can seek treatment. And most members of parliament who had these tournaments, that is where, even Honorable Maingi had hers just the other day, that is where we were creating awareness. Hence, for that reason, we are saying it is inappropriate again for government. Those are some of the gains we can say we have made. The government again has come up and said, no, this amount, you don't need to do sports and talent development. Let's take it elsewhere. So we need a concerted effort and a detailed framework on how we are going to deal with this at a national level, not just in Mount Kenya or Kirinyaga or even Mombasa alone. It is a national problem that we cannot let this weighty issue just slip away.
Precisely the point, because Nairobi, Eastern, Central, Western have different levels in terms of the consumption of illicit liquor, consumption of alcohol, prevalence in terms of potable spirits, the use of tobacco, cat, cannabis, and also the number of users that keeps on increasing. Dr. Yvonne, I mean, you look at the consequences or the impact this is having, one, on the education sector because of learners who are abusing certain substance, and then second, for the other users of other substances, the impact on the family unit, the breakups that normally happen, either the cases of divorces that are going up or cases of gender-based violence on either sides because of someone who is under influence. How do you counter this? Because it seems it's also spreading into the quarters of other government agencies and ministries, but still you are at the epicenter of coming up with answers to these problems.
Thank you for that. Now, as NACADA, we have a coordinative function. So when it comes to issues of schools, for example, we do not just walk into schools. We bring in the stakeholders in the education sector. For example, we'll have to bring in MOE, we bring in TSC, and the other stakeholders, and we sit down and they're like, this is the situation of drugs in our school. Like, if you look at the findings for primary schools, for example, we're talking about prescription medication being the highest at 7%. So we have to go back and say, children don't just buy medication, so how is it that they have these high numbers? And you're like, this must be parents. So as a team, then how do you go about it? Then in the school settings, you realize now when they're having the parents meeting, the AGMs, they say, NACADA, send us someone. NACADA, tell us who in our community here does this. Then you're like, oh, we have partners here, go and talk to the school. So that the schools, the parents, the whole community within the education setup are attended to. But at a wider society, as Bwana Kamau mentioned, for example, with the cannabis, people say it is not that bad until you hear somebody calling you and saying, something is strange. This person is chasing me around with a panga. It is not just the issue of breakages of families. There's the issue of homicides. You know, alcohol and other drugs cause psychosis. They literally bring about mental illnesses. And if we do not come as a team and then say, no, this substance, as much as you're not seeing it is this severe, these are the repercussions. So that when you're being chased around in your own boma, with your own child, with a panga, don't say it was just herbs. No, that was a serious drug. Same with alcohol. We've been talking about the illicit alcohol. If you look at our survey findings, Central was leading in terms of potable spirits. So it is not just an issue of alcohol. Western is leading, but when you look at the deaths, then Western is not as bad because the aspect of potable spirits is not that much across the country. It is more at the Central. And that potable spirit is majorly the illicit alcohol. It doesn't have to be the changa in the den. It can be in a bottle, but it is still illicit. And that is why the Ngao is on the ground cracking. And that is why, like with Kirinyaga, the idea is, what is it, as both Honorable Kibagendi and Bwana Kamau said, what is it that is in this bar? Because it might be in a bottle, but it is still illicit, and it has not been approved for the consumption. So when we are bringing together people, we don't do as NACADA. We say, everybody come. What is the way forward? We've been doing this. It doesn't seem to be working so well. what else can we do? So we keep bringing people to the table so that we keep changing, we keep exploring more evidence-based, not just, to use his words, not just knee-jerk reactions, but evidence-based interventions that have been shown to work globally. Right. Then we try and bring them home.
I'll come to you, Honorable Mary Maingi. Stanley, she points the factor about potable spirit. Western Kenya, Central Kenya leads by 4.1%, followed by Coast 3.2%, and the Rift Valley 3.1%. These are significant numbers. But these potable spirits must be transported from point A and then ends up in Central Kenya, which leads, then ends up in the coastal region and ends up in the Rift Valley region. Involves logistics. Here involves the security question of doing the necessary checks that ought to be done. And all these supervisory processes seem to be violated and involves government officials. Then, to be clear, the cost of corruption in all this, leading to the deaths of Kenyans, innocent Kenyans. How concerning is this?
It's very concerning, and I can tell you. Let me give you an example of what we did a few months ago in Murang'a. We did, maybe you saw it, we did a balloting in the village. We brought about 500 women, especially those who have been affected in the families. We did a ballot. We did one ballot for illicit brew, another ballot for Bangi. And people were actually voting for the community members who sell those substances. And then, together with the county commander of Murang'a and the county commissioner, we are able to net a lot of people. And then we gave a few of them an amnesty that if you are selling, please bring all those things you have here. And it worked. And I think it's a high time that the government needs to give an amnesty to the people who are making this illicit brew and selling Bangi for at least 1 month, so that they can be able to, if we have done that with illicit weapons, we can do it with illicit brew. Let's give them an amnesty for now, so that they can come out, they declare this is what they do, and this is what they have done, but they have surrendered. Another thing that we need to do is that we need to invite the public to tell us what is this one characteristic, and Nakada can tell us, of these people who actually abuse drugs in the villages. What is this characteristic? Do we have, is it broken families? Is there mental illness? Is there maybe family issues? We need to get these characteristics, because I can tell you, it's very hard for you to see a member of parliament, even if how drunk, getting into that particular point where he has to die because of drinking. Why? Because there are other factors. These people, one of the characteristics is these people who die, if you look at when they ate last, you'll be told that they have not eaten for days. What does that tell you? These people are drinking, not because they don't have money, but they have money that is valueless. If you have 50 shillings, it cannot buy you food, it cannot buy you clothes, it cannot pay school fees. You want to get laid, you want to expose money that is useless in your pocket. And that's why they take this illicit brew. Because if you have 20 shillings, it cannot buy you tomatoes, cannot buy you potatoes, cannot buy you unga. So what do? So this thing of saying people drink because they don't have money, it's not because they don't have money. It's because they have useless money in their pockets. They need to dispose of so that they can think of where to get money to do something in future. May be long, but I think that's one of the biggest problems we have. We have limited financial strength for these people. They get 100 shillings. When they try to look at what these 100 shillings can do for their lives, they realize the only thing is to get high and maybe wake up tomorrow morning and face the world in a different way, because they do not have the capacity to buy anything with that kind of shillings.
Okay, please proceed.
And then the other thing is, what are we doing to these people to put money that is more variable in their pockets? That's why, like in Murang'a, we have partnered with different stakeholders that we get these addicts, get them into TVET, they do courses, and then buy for them those materials, if it's plumbing works, if it's electrical works, so that they can start earning a living. And when you start earning, when you get some money in your pocket, all this money become very useful to you. Money does not become useless. But when you have useless money in your pocket, even here, even members of parliament, even us, sometimes you may get 20,000. But when you look at your expenditure, it's about 1 million shillings. What do? You think about going straight to the bar to sit down and think what to do with it. And in the process of thinking, you squabble all that money.
Okay, and I want to understand the point of admission for the case of someone who wants to spend, say, that 50 shillings. What then explains, from your understanding, of course, as a person who has been advocating for solutions to these problems, what then explains the case of the granny who was almost in her 60s and early 70s, who went up and ended up to be among the victims in Kirinyaga County?
These are now the ones who are now carried away by other people. And I can tell you, like Bagendi and Mheshimiwa here, when they go to their constituencies, sometimes, even me sometimes, I normally have that loose money, like 50 shillings. Because everybody would stop you. And because you don't want to listen to other problems, this money is not actually it's not for anything. It's to chase them away from you for that particular moment. Not solving their problem. It cannot solve a problem. Yeah? But because you know it cannot solve a problem, what do? That's the only money they have in their pocket, which they cannot take home. They have no other 50 shillings to add to 100 shillings to buy unga. Yeah? So, and you know, Misali loves company. And because there are many with 50 shillings, what do? They combine forces, they go and buy one jug of whatever, and they drink. And then they and they forget their problems.
Is it then fair to say that you're part of the problem?
No. But by that, it's very also biblical. That drinking is for the people who are miserable, so that they can forget about their misery. It's there in the Bible, that drinking is for the misery, so that they can drink and forget about their misery. So we need to get them out of these miserable situations by empowering them and giving them livelihood that they can be able to depend on in the whole of their lives.
Yes, Honorable Mike, yes, you had a point.
Yeah.
Before we sample the feedback.
Okay. I was going to say to Mr. Kamau, my friend here, that a drink does not take away your problems. It's a very temporary thing, and it's a very temporary way of thinking about it. Your problems will still be there once you sober up. Now, if we look at the case for Kirinyaga, the people who died were between 39 years and 72 years. So these were not youth. And I would want to urge all of us, like we agreed that all of us have a role to play in the fight, in this fight against illicit brew. The local community should desist from stigmatizing these people who are addicted to illicit brew, or these people who are partaking of this illicit brew as a start. As the leadership and as a member of parliament and other leaders, we need to engage these people into economic activities so that they have something to do and something gainful. In the case of Mwea, I've engaged most of these people in contract farming of sorghum with Kenya breweries. Now, those people that could not plant anything in their land can now plant sorghum and get money from Kenya breweries, because the greatest problem of a farmer is the market. So I started with the market. I spoke with Kenya breweries, and they agreed to partner with us for sorghum farming. Now, I would want also to laud Her Excellency, the Deputy President's wife, Dr. Pastor Dorcas Rigathi, who said, after all is done, if everything does not work, then we are going to do it the heavenly way.
Okay.
We are going to have churches. And she promised, and she agreed, and she said that all churches are going to have a department dealing with people who are addicted to illicit brew. We're going to have 2 hours where the preachers, where the pastors, the priests will be talking to these people who are partaking of illicit brew. They will even be having meals to give to these people. They'll be having them every Sunday and every so often, so they can talk them out of this menace.
Wonderful. Thank you. Let's now sample the feedback and give you the final comments here on the broadcast. The hashtag on X is Daybreak. The SMS code is 22422. at Citizen TV Kenya and at Ayub Abdikadir. Here's what you're saying. Charlo Ward Rossi says, it is really worrying to see the government spending over 50 billion without the approval of the control of budget, yet they're accusing other sectors of corruption. They're increasing taxes and at the same time wasting the money. Very unfortunate, he says. Babu Michel K says the current fight of illicit brews is mostly in Kirinyaga County is a misplaced one. It's not shutting bar, but making sure that the people are mentally stable and the legit liquors are the only ones available. It's about economic empowerment too. Unnamed says funding the fight against drugs should be locally generated with the donor civil society. Will make it a permanent problem like teen pregnancy. They will want it to be there for money to come. Let us use our own money to save our country. Daybreak, the hashtag. Sir Nixon Dugure says addressing the reason that leads to drugs and substance abuse is very paramount. Relapse is real. Otherwise, nobody stays recovered unless the life they have created is more rewarding and satisfying than the one they left behind. Engineer Lazaro says Nakada is just toothless bulldog with only powers to issue and to revoke bus license. Government should take big share of blames for failing to stop corrupt quick money makers from selling killer brews, corruption in the police service. Bob Otieno Wino says the government should work with Nakada hand in hand to control alcohol and drugs menace, more so make alcohol cheaper to eradicate illegal brewers which has led to the losing of lives of many Kenyans. New_Star says in Kirinyaga, people did not die of alcohol. They died from taking illicit brew. People are taking these brews because the prices of regular alcohol have hiked due to overtaxation by Ruto. He means the president. The solution is simple: lower the cost of alcohol. Gode Barasawere again says there is a silent link between agencies that license and regulate liquor and other products, the counterfeit products that flood the market, and then are as a result of some corrupt officials who get bribes and look the other way. Ian Sely says fighting illicit brew is a seasonal thing in Kenya. Nakada Kenya and the Kenya Bureau of Standards should come up with safety modalities and standards to ensure that the alcohol cottage industry also taps the market. Not all Kenyans can afford. Is that the right pronunciation? Yes, Anthony, we begin with you. Final comments, briefly.
These are the final comments?
Yes.
Now, those who are talking about reducing the cost, they need to be aware that there are further taxes. There's more excise duty that is going to be added to alcohol beverages, and hence, alcohol is going to be more expensive.
So more or less, it's a sin tax.
Yeah, so that is going to happen. And what I would like to say is that the president, who is the CEO of the Republic, needs to be aggressive in this fight, like he's aggressive with e-citizen and all these other things that they hopefully will be profiteering from. Let them also work hard in fighting the drug and substance abuse, because in the long term, it is a heavy burden on government, especially when it comes to treatment, including tobacco and bangi and all this, because tobacco, we know, causes lung cancer and all these other things.
Yeah.
So we need to be aggressive in trying to reduce the effects of these things in our society. And to finish is to encourage young people. I want to repeat this again, that keeping off drugs is easier than getting off drugs. Let us all come together and work towards dealing with this menace in our society. From the churches, I'm happy with what Honorable Maingi said, what Madam Dorcas is working on. The church needs to step up as well, so that they begin their rehabilitation process at the church level. So that beyond that, it means it is someone that is extremely in need of medical support.
Yes, Dr. Yvonne.
Thank you. And just to say thank you to the panelists, because they actually were able to lobby for Nakada to take back the licensing. And as Nakada, we are actually very ready to take this function, because we want to protect Kenyans and ensure that bars are not just everywhere. And also to highlight that this week in particular is the National Substance Use Prevention Week, that we are rolling out activities across the country. So we have regional offices reaching out to schools, workplaces, other community levels. We are having baraza meetings with the chiefs and the community, just to talk about issues of alcohol and drug abuse, aspects of prevention. So the focus this week is prevention, prevention, prevention.
Okay.
We have more people who are not using drugs than the ones who are using drugs. But the focus has majorly been on the ones who are using drugs. So we also want to support the ones who are not using so that they do not start.
Yes.
And the ones who started, we support them on how to actually stop. So we're saying if you want to join us, go to the NACADA website. Activities are there. We'll be having a summit at Bomas just to bring the people who are in the field to share the experiences and learn from each other.
Thank you.
Let us continue fighting this war together.
Thank you. Yes, Stanley.
For me, there's one is that as the role models or the leadership, we should first of all avoid exposing the use of drugs and alcohol in public. What I would urge maybe the leadership and government officers and even parents, let's not expose alcohol and such other abuses to our children. Let's try as much as possible. We do it when the children are not watching. And two, the best intervention method for eradication of, to rehabilitate these young people is economic empowerment. Let's see how we can be able to bring these youth together. Let's start for them something small that can actually bring some income and also put some food on their tables.
Yes, Honorable Mainge.
I would like to start by reassuring my colleague, Honorable Kibagendi, that this fight will be won. This government is committed to fight against illicit brew, and the CS, Professor Kindiki, is burning his midnight oil at it. So be reassured.
Thank you.
Honorable Mary Mainge, thank you. Mwea lawmaker, your time is appreciated. Kitutu Churches South lawmaker Anthony Kibagendi, thank you as well. Dr. Yvonne Olado is the Director, Prevention and Treatment Programs at NACADA. Thank you for your time. Stanley Kamau is the Chief Executive Officer of Ahadi Kenya, Ahadi Trust. Thank you for your time as well. And thanks to you too for watching the broadcast and being with us here on Daybreak. Good morning.